13 early signs of heart failure you ignore daily. Did you know that every 36 seconds, someone dies from heart disease? But what if the real danger isn't the heart attack? It's what happens months or even years before that final moment. Because right now, your body could be warning you silently, subtly, every single day. And 99% of people don't even realize it. Heart failure doesn't come out of nowhere. It builds slowly. It whispers. It tricks you. And the signs? They're not just chest pain or fatigue. They're everyday things you're brushing off. Like why you suddenly need 3 pillows to sleep. Why you can't sleep on your back. Or why tying your shoes leaves you breathless. In fact, a 2022 study published in JACC, Heart Failure, revealed something terrifying. Nearly 1 in 3 older adults showed signs of heart dysfunction with no diagnosis at all. No one warned them. No one told them what to look for. Until it was too late. And here's the kicker. The number one most ignored symptom could increase your risk of hospitalization by 73%. It's not chest pressure. It's not palpitations. It's something most people think is just mental. But science now confirms it could be your heart's first cry for help. You can literally change your future if you catch the clues now. In this video, we're going to uncover 13 early signs of heart failure that most people completely overlook. Some of these might surprise you. By the end of this video, you'll know exactly what to watch for and when to act. Before we dive in, let us know in the comments below your age and where you're watching us from. We're reading and replying to every single comment, so drop your comments below. Now let's start with one of the most ignored yet most common signs, because once you recognize this, everything changes. Number 13. Swelling in the feet or ankles. When your socks leave deep marks around your ankles or your shoes suddenly feel tighter by the end of the day, your body might be telling you something far more serious than you've been on your feet too long. Swelling in the lower extremities, also known as peripheral edema, is one of the earliest signs that your heart isn't pumping blood effectively. Here's what's happening. When the heart weakens, it can't push blood forward as strongly. As a result, blood begins to back up in the veins, especially those in your legs and feet. This backward pressure causes fluid to leak into surrounding tissues, and that's what creates the swelling. Unlike temporary puffiness from heat or salty foods, heart-related swelling tends to be persistent, often worsening throughout the day and improving only slightly overnight. A study published in Circulation in 2018 tracked 1,200 adults with early-stage heart failure and found that 63% reported ankle or foot swelling before they experienced any chest symptoms at all. What's more, many of them dismissed it as aging or weight gain. This kind of swelling isn't usually painful at first. It feels tight, sometimes heavy, and can leave indentations if you press on it. If it keeps happening, especially if it's in both feet or combined with shortness of breath, you need to pay attention. It's your heart waving a red flag. Most people ignore it until things get worse, but you don't have to. This sign might be low on our list, but it's still a serious clue that something deeper could be wrong. Number 12. Needing to pee more at night. Waking up once during the night to use the bathroom isn't unusual. But if you're getting up 2, 3, even 4 times every night, your body may be dealing with something bigger than just aging kidneys. The term for this is nocturia, and while it's often blamed on prostate issues or overactive bladder, it's also a classic early sign of heart failure. When your heart struggles to pump effectively during the day, blood can pool in your lower body, especially in the legs. But at night, when you lie down, that fluid redistributes and returns to your bloodstream. Your kidneys, now dealing with the sudden increase in blood flow, go into overdrive to filter it out. And that means more trips to the bathroom. A 2019 study in the Journal of Cardiology found that people with nocturia were 33% more likely to have undiagnosed heart problems, especially when paired with other symptoms like swelling or fatigue. It's not just about losing sleep. It's about your heart not being able to keep up. The real red flag is when this nighttime urination happens without drinking a lot of fluids before bed. If you're limiting your evening intake but still waking up multiple times to pee. Your heart might be struggling to keep blood moving efficiently. It's a subtle but powerful sign that often gets overlooked because it seems so ordinary. But the science is clear. Nocturia can be a warning your heart is overworked and underperforming. Number 11. Persistent cough or wheezing. If you've had a nagging cough for weeks that just won't go away, especially if it gets worse when you're lying down, you might be dealing with more than just allergies or a leftover cold. One of the early, and most ignored, symptoms of heart failure is a dry, hacking cough or light wheeze. That's because fluid can start to build up in the lungs when the heart isn't pumping efficiently, especially in the left side of the heart. This is known as pulmonary congestion, the result. A cough that sounds like you're clearing your throat constantly, or wheezing that resembles mild asthma, particularly when you're lying flat. That's why many people with early heart failure prop themselves up on extra pillows to sleep more comfortably without realizing why it helps. In a 2020 study published in ESC Heart Failure, 41% of patients who were later diagnosed with heart failure reported having a persistent cough for over a month before they were ever seen by a cardiologist. What's alarming is that over half of them were given inhalers or antibiotics at first, completely missing the real issue. This type of cough doesn't usually come with mucus. It feels dry, irritating, and stubborn. If you find yourself coughing more at night or getting winded while speaking or walking, don't just assume it's your lungs. Your heart could be the culprit. And the longer it's ignored, the more fluid builds up, leading to bigger problems down the road. Number 10. Unexplained weight gain. Most people think weight gain happens because of overeating or lack of exercise, and most of the time, that's true. But when your weight suddenly jumps by 3 to 5 pounds in a matter of days, and you haven't changed your diet, that's a sign your body is retaining fluid. This is one of the earliest red flags in the development of congestive heart failure. Here's why it happens. As your heart weakens, blood backs up and causes fluid to leak into tissues, just like we talked about with ankle swelling. But that fluid doesn't just go to your feet. It builds up all over your body, in the abdomen, in the lungs, in the limbs. That added fluid shows up on the scale fast, and it doesn't come off easily. A 2022 study from the Journal of Clinical Heart Failure found that patients who experienced a weight gain of just 4 pounds in 3 days were 48% more likely to be admitted to the hospital for worsening heart failure within 30 days. That's how serious fluid retention is as a warning sign. Unlike fat gain, this type of weight gain often feels uncomfortable and bloated. Your clothes feel tighter, your rings don't fit, and you might notice a general puffiness all over. The key difference is speed. When weight gain happens rapidly without a clear reason, your heart could be struggling to manage blood flow and fluid balance, and that's a sign you can't afford to overlook. Before we continue, if you have been enjoying the video so far, hit that like button so more seniors can see it, and subscribe. We've got more powerful senior health tips videos coming every day, and you don't want to miss the next one. Number 9. Difficulty lying flat without shortness of breath. It sounds strange, but if you suddenly find it uncomfortable to lie flat because you feel breathless or like something's pressing on your chest, that's a signal your lungs may be filling with fluid. This condition is known as orthopnea, and it's a classic early indicator of left-sided heart failure. When the heart can't efficiently pump blood forward, especially from the left ventricle, blood can back up into the pulmonary veins, the vessels that return blood from the lungs to the heart. That backup increases pressure in the lungs, causing fluid to leak into the air spaces. This makes it hard to breathe, particularly when gravity no longer helps drain that fluid, like when you're lying flat. Most people first notice this when they start stacking pillows or sleeping in a recliner just to breathe comfortably. A 2017 study from Heart and Lung found that people who reported orthopnea were twice as likely to have measurable left ventricular dysfunction. Even before their ejection fraction, a key heart pumping measure, dropped below normal. This symptom is often brushed off as snoring, weight gain, or even acid reflux, but it's actually one of the more specific signs that your heart is struggling to keep up. If lying down makes you feel like you're drowning, your body is trying to tell you something urgent. Pay attention to that change. It could be one of the earliest signals your heart is in trouble. Number 8. Sudden fatigue or weakness. You wake up feeling fine, but just a few hours into your day, it feels like someone pulled the plug on your energy. Suddenly, climbing stairs feels like you just ran a marathon. Carrying groceries feels like lifting weights at the gym. And no matter how much you rest, you don't bounce back the way you used to. This kind of deep, unexplained fatigue is one of the body's earliest cries for help when the heart can no longer meet the muscle's demands for oxygen-rich blood. What's happening under the hood is simple but dangerous. Your heart is a pump, and when that pump starts to fail, less blood gets pushed out with every beat. That means less oxygen and nutrients reach your organs and muscles, especially during activity. Your body responds by shifting into energy-saving mode. You feel slow, weak, exhausted even after simple tasks. Not tired in the I need a nap way, but in the I can't even make it through the afternoon way. In 2021, researchers at the Mayo Clinic published data showing that 72% of early-stage heart failure patients listed fatigue as their first noticeable symptom, often long before chest discomfort or irregular heartbeats appeared. But most of them blamed it on aging, depression, or poor sleep. If this kind of fatigue creeps in and becomes your new normal, don't ignore it. Especially if you're sleeping well and eating right but still feel like your body is constantly out of fuel. Your heart might be running on empty. Number 7. Rapid or irregular heartbeat. We all feel our hearts race sometimes, during exercise, stress, or excitement. But when your heart starts beating fast or irregularly for no clear reason, that's a major warning light on your body's dashboard. This symptom, called tachycardia if it's fast or arrhythmia if it's irregular, can indicate that your heart is trying to compensate for weakened pumping power. When the heart can't push out enough blood with each beat, it may try to beat faster to make up for it. But this faster rhythm isn't efficient. It just puts more strain on a failing system. Over time, this can lead to palpitations, fluttering sensations in your chest, or even skipped beats. You might feel lightheaded, anxious, or like your heart is thumping against your ribcage. A 2018 study in the European Heart Journal found that resting heart rates above 80 beats per minute were associated with a 45% higher risk of developing heart failure over 10 years. Even more troubling, patients who reported occasional heart flutters had a 30% higher chance of having hidden structural heart issues. The key here is consistency. If your heart skips a beat once a month, that's probably harmless. But if it happens daily or during rest, your heart could be struggling to stay in rhythm due to muscle weakness or chamber enlargement. Don't assume it's just anxiety. An irregular heartbeat might be your heart waving the white flag early. Number 6. Loss of appetite or feeling full quickly. You sit down to eat your favorite meal, but halfway through, you feel bloated, full, or just not interested. If this is happening more and more often, especially without any changes in your diet, it might be a sign your digestive system is being affected by heart failure. Most people don't connect eating problems with heart problems, but there's a surprising and direct link. When the heart starts to fail, blood is redirected away from less vital organs to keep the brain and heart itself functioning. One of those less vital systems is digestion. That reduced blood flow can slow down your stomach's ability to process food, leading to early satiety, that is, feeling full too fast. At the same time, fluid retention can cause swelling in the liver and digestive organs, putting pressure on the stomach and reducing appetite. In a 2020 study in the American Journal of Clinical Nutrition, over 55% of newly diagnosed heart failure patients reported appetite loss or early fullness as one of their first signs, and most of them had lost 5 to 10 pounds unintentionally over the course of just 1 month. This isn't about dieting or disinterest in food. It's a physiological shutdown, a message that your heart can't support full digestive function anymore. If eating feels like a chore, and you start skipping meals or feeling queasy after just a few bites, it's worth considering whether your heart is to blame. Number 5. Confusion, memory problems, or dizziness. You walk into a room and forget why. You struggle to find words you used to recall easily. You get lightheaded when standing up, or feel woozy even when sitting still. These signs are often brushed off as senior moments. But in many cases, they're directly tied to your heart's declining ability to circulate blood and oxygen to the brain. When your brain isn't getting enough oxygen-rich blood, it doesn't work as well. Simple as that. The fogginess you feel is cerebral hypoperfusion. That's the medical term for low blood flow to the brain. It doesn't just affect memory and focus. It can change your mood, your balance, and your ability to function day to day. A 2019 study published in Neurology found that older adults with early-stage heart failure were 58% more likely to develop cognitive problems within 2 years compared to those with healthy hearts. What's even more concerning is that many of them had no major chest symptoms, just subtle changes in mental sharpness and occasional dizziness. Dizziness itself often happens because the heart can't adjust quickly to changes in posture. Standing up too fast drains blood from the head, and if the heart can't compensate, you feel faint. It's not just a blood pressure issue. It's a whole system slowdown. If brain fog is becoming more common or you're having trouble remembering basic things, don't assume it's just aging. Your brain runs on blood, and your heart is the delivery truck. If it's lagging, your brain will start missing shipments. Number 4. Shortness of breath during normal activities. You're walking through the grocery store or climbing one flight of stairs, and suddenly you're winded like you just sprinted. That kind of breathlessness, especially if it's new or getting worse, is one of the clearest and most dangerous early signs of heart failure. It's also one of the easiest to ignore because it builds up slowly. Here's why it happens. When the heart weakens, it can't send enough oxygen-rich blood to the muscles, especially during activity. At the same time, fluid starts backing up into the lungs, reducing the amount of space for oxygen exchange. That means you're getting less oxygen in with every breath, and your body knows it. So it tells you to breathe faster, harder, and more often. According to a 2023 study from the Journal of Cardiac Failure, shortness of breath during everyday activity was reported in over 80% of patients within 6 months before being diagnosed with heart failure. But more than half of them attributed it to being out of shape or getting older. The scariest part. This breathlessness often shows up long before any heart pain or palpitations. It may start with just a little huffing and puffing on hills or stairs, but soon, walking across the room feels like work. It's not just your lungs being lazy. It's your heart whispering that it's struggling. If you find yourself pausing to catch your breath more than usual, even when doing basic tasks, your body is trying to tell you something, and the message is urgent. Number 3. Blue or purple tint in lips or fingertips. It's subtle. Maybe you catch it in the mirror one morning. Your lips look a little darker than usual, almost like you've been out in the cold too long. Or your fingers have a faint bluish hue when you're washing your hands. You rub them, warm them up, and think nothing of it. But here's the truth. When your skin turns blue or purple in spots, especially the lips, fingertips, or toes, your blood is not carrying enough oxygen, and that's a big problem. This condition is called cyanosis, and it happens when there's not enough oxygen in your blood to give it that bright, healthy red color. Instead, it turns darker, almost purplish, and that change becomes visible under the skin. The main reason this happens in early heart failure is because the heart can't circulate blood efficiently enough to all parts of the body. The oxygen-rich blood gets delayed, and the skin tissues near the surface are the first to feel the shortage. In a 2022 study from the American Journal of Emergency Medicine, researchers found that mild peripheral cyanosis, especially in fingers and lips, was present in over 38% of undiagnosed heart failure patients who came to ERs for unrelated reasons, and many of them didn't even realize their color had changed. What's even more dangerous is how often this sign is mistaken for cold weather effects or poor circulation. But if you're seeing this discoloration indoors, in normal temperatures, and especially if it's happening regularly, it's a serious signal that your heart is struggling to deliver oxygen where it's needed. This isn't cosmetic, it's cardiologic. Number 2, chest tightness or pressure, not pain. Let's clear something up right now. Most people think of chest pain as the number one symptom of a heart problem. And while pain is serious, many early signs of heart failure don't feel like sharp or stabbing pain at all. Instead, they feel like pressure, tightness, or even a sensation of heaviness in the chest, particularly in the center or left side. It might come and go. It might get worse during exertion or when lying down, and is often easy to brush off as heartburn or anxiety. But it's your heart telling you it's running out of steam. This kind of pressure happens when the heart muscles aren't getting enough oxygen, often due to fluid buildup or poor circulation. The sensation is your body's version of a warning light on the dashboard. Something isn't right with the fuel delivery system. And unlike the heart attack, which is sudden and crushing, this feeling tends to be gradual, persistent, and oddly tolerable, which makes it even more dangerous because people wait too long to act. In a 2021 study published in JAMA Cardiology, over 50% of patients with early heart failure described their main symptom as chest pressure rather than pain, and most of them had been misdiagnosed with acid reflux or musculoskeletal tension before finally getting a cardiac workup. If you feel like someone is sitting on your chest during activity, or like your chest just can't fully relax even at rest, don't dismiss it. That's not normal aging. That's not just anxiety. That's your heart, whispering louder and louder that it's in distress. Number 1, depression or a sudden drop in motivation. And here it is, the number one most ignored early sign of heart failure. Not swelling, not chest pressure, but something so common, so easy to miss, that it gets misdiagnosed or completely brushed aside in millions of people every year. A sudden, unexplained drop in mood, motivation, or mental energy. Depression, not just sadness, but emotional and cognitive fatigue, has now been scientifically linked to early heart dysfunction, even before any other physical symptoms show up. A 2022 study from the Journal of Affective Disorders followed 3,100 older adults with no prior heart diagnosis. Those who scored high for new-onset depressive symptoms were nearly 60% more likely to develop clinical heart failure within the next 5 years. Even more shockingly, those with untreated depression had worse outcomes once diagnosed, including higher hospitalization and mortality rates. Why does this happen? It's biological, not just psychological. When the heart weakens, the brain receives less oxygen and fewer nutrients. On top of that, inflammation and hormonal changes linked to heart failure can interfere with brain chemistry, specifically serotonin and dopamine, the chemicals that regulate mood and motivation. The result: you feel emotionally flat, tired of life, disinterested in things you used to enjoy, and disconnected from your usual self. Most people blame this on stress, age, loneliness, or life changes. But if your mood has shifted dramatically, especially alongside fatigue, poor sleep, or even subtle physical changes, you need to look deeper. Your brain is the first organ to notice when the heart isn't keeping up. And this emotional warning often comes before any physical one. This is why it ranks as number 1, because it's the quietest, the most overlooked. And yet, according to recent science, it could be the earliest and most powerful signal your heart is failing. If there's one sign to never ignore, it's this. So there you have it, 13 signs your heart could be in trouble, and you might not even know it. These aren't random aches and pains. They're signals. Each one is your body's way of saying, pay attention. Something is wrong. And the earlier you catch them, the more power you have to change your future. If you notice more than one of these signs in yourself or someone you love, don't panic, but don't wait either. Talk to your doctor. Get checked. The worst thing you can do is ignore the whispers until they become screams, Because the truth is, heart failure doesn't wait. But neither do miracles, if you catch it in time. Before you go, tell us in the comments below, have you ever brushed off one of these symptoms, thinking it was nothing? Or do you know someone who ignored the early signs until it was too late? Your story might save someone's life. Let's talk about it. We're reading and replying to every single comment. Thanks for watching.